We are here today. We're going to do a central line dressing change for a triple lumen catheter, and this would be the kit that you would need. Make sure you follow all steps of the checklist, including checking the order, identifying your patient, hand hygiene, placing clean gloves, bed position, etc., and explain to your patient what you're going to do. So if this patient had an old dressing in place, I would carefully peel from the edges, making sure that the catheter itself is not being dislodged at all. Most of the time it's going to be sutured in place. And I'm going to be very careful. I would dispose of that dressing in my gloves. And then I'm going to inspect the site. I'm looking for signs of infection, any type of bleeding, other drainage, any type of cracks, etc., that could be in the tubing. So when I'm all done with that, I'm going to discard my clean gloves. I'm going to do hand hygiene. And I'm going to open my central line dressing change kit. Remember, the outer edges are considered non-sterile. I'm going to carefully remove the packaging list. And let's see here. It looks like I need to flip this over carefully. There we go. This is a drape that you could use for your patient or possibly to create a sterile field on the table if you so choose. There are 2 masks in the kit. I'm going to place one on myself, carefully, not touching the front. Make sure I'm securing that because this is a sterile procedure, and realizing also that this is going directly into the patient's central bloodstream system. I'm not able to get the mask around Justin's ears here, but you would place a mask on your patient also. The next thing I'm going to do is I'm going to grab the sterile gloves. Now these are a medium. They actually are somewhat tight. So if you have larger hands at all, you may want to make sure you let your instructor know and get a different set of sterile gloves. I'm going to don those gloves. Of that by touching the middle only. Move this over a little bit more for myself. There is hand hygiene sanitizer we can use in a little while. And I am going to get my chloroprep or chlorhexidine. And this is what I'm going to clean the site with. So what I need to do is I need to break this. You'll be able to hear the break. Squeeze it a little to get the solution. And then I'm going to very carefully, again, I'm maintaining sterility. I'm not touching the patient. And I'm going to cleanse back and forth for 30 seconds in this back and forth motion, certainly getting over top of the insertion site and the blue tip itself and the surrounding area. For time purpose, I'm not going to do the whole 30 seconds here. Let that air dry. And then there is skin prep in here that you can also use, especially if your patient is diaphoretic, etc. There are alcohol swab sticks if there's a lot of blood and you need to clean that before the chloroprep. And I'm going to grab my dressing. You can see this is a Tegaderm that has a CHG patch built into it. I'm going to remove the plastic film. And the dressing itself, the CHG patch, it goes directly over the insertion site and the blue tip. And I'm going to bring my I'm going to secure that very well. And then I'm going to take these outer wrappings off. Justin has a little bit of a crack here. Okay, I'm going to make sure that is secured and that all three of my ports are sticking out. I can then use these pieces to secure the area even more. So with this one, what I can do is come up around like this and place this in place here so that everything is nice and secure and I only have the ends of the ports coming out. I'm going to remove my sterile gloves, do my hand hygiene, and there is a built-in date and initial area on the outside of the Tegaderm, and there's also a label. I'm going to go ahead and use this, and I'm going to date it, and I'm going to put my initial, and then I'm going to secure that. I can actually secure it right over that area just for another seal. And our whole entire central line is now in an occlusive dressing. I would then obviously do hand hygiene, clean the patient up, my supplies, bed down, all those things to end the scenario, end your scenario or your dressing change. This is a Huber needle, and I wanted to show you that there is actually a different kit when you are changing a Huber needle, which is considered a central line. It includes a bio patch, and that bio patch sits right on top so that it is securing, and then the opsite would, or Tegaderm would go right over that. And that is listed separately on your checklist. I thank you for your attention and look forward to seeing you in class.